Miss Rachel. I'm going to be your nurse today. What is your name?
Daniel.
And how old are you?
17.
Okay, Daniel, today you're in for a peripheral vascular, musculoskeletal, and neuro assessment. First, starting off with the range of motion of your neck. If you will look down and look all the way back. Now back at me, to the side, and to the other side. Now all the way around. Okay, is there any pain when you do that?
No.
Okay, next I'm going to move on and I'm going to be testing for cranial nerve number 11. It's also known as the spinal accessory. If you'll push against my hand, other side. Now push with your shoulders up, really. Okay. Next, I'm going to move on and I'm going to be looking at your upper extremities, your arms. I'm looking at your skin. I'm feeling them and they're nice and warm and dry. I'm looking at your hair distribution. I notice that it's evenly distributed. There's no missing patches of hair. And next, I'm going to be looking at your nail beds. They're nice and clean. Your capillary refill is less than 1 second. Less than 3 is ideal, so that looks good. If you'll squeeze my finger, other side. Okay, now I'm going to be feeling your pulses of your upper extremities, which is radial. Okay, they're nice and even and strong. Next, I'm going to be feeling for your brachial pulses. Okay, equal and strong. Next, I'm going to be moving on and I'm going to be looking at the range of motion of your upper extremities. If you'll roll your shoulders, now roll your arms, your elbows, wrist, and fingers. All right. Any pain when you did any of those?
No.
Okay. Now I'm assessing the muscle strength. If you will put your arms like this, push against, pull, now push out and push in. All right. Now, if you'll lay down, I'm going to be looking at your lower extremities. First of all, I'm looking at your skin once again. I'm looking and feeling. I don't notice anything odd. It's warm and it's dry. Your hair distribution is even. There's no missing patches of hair here either. And I don't notice any varicose veins, and I do not palpate any edema in either leg. Okay. Next, I am going to be assessing the peripheral pulses. So I'm going to start off with your femoral pulses and the popliteal, which is behind your knees. Okay, and inside your ankles, which is your posterior tibial pulses. And on top of your foot, which is your dorsalis pedal pulses. Okay. And next, I'm going to be doing the heel to shin neuro test. If you will take your heel and bring it to your knee. And now, here, just like this. And now roll it down your shin. Okay. And then do the other and slide it down your shin with the other foot from your knee. Okay. All right. And now I'm going to assess your range of motion of your lower extremities. If you will bring your foot to you. Now try to bring it to your chest. Back down. Out, okay, back up and down. Now bring this one up to you, to the chest, back down, to the side, back up, and back down. All right, now if you'll roll your ankles, good job, okay? And wiggle your toes, okay? Next, I'm gonna be looking at the muscle strength of your legs. If you will push against my hands, push against my hands, out, and in. Okay. All right, moving on from there, I'm going to do, okay, and then I did up here, now I'll do here, up, out, in, and push down, and up on your feet, down. Okay, now I'm going to do the Babinski reflex. So I'm going to use my pen light. And I'm looking at that reflex. Okay, you're negative for that side and negative for this. What I'm looking for in that is anyone over 6 months old their feet should not fan out. So yours did not. Okay, now I need you to sit up and I'm going to be checking for patellar reflex. Usually we would use a patellar hammer, reflex hammer, but I don't have one, so I'm going to be using my stethoscope. Okay. Alrighty. So So that was good. Now I'm moving on and I'm checking you for scoliosis. If you'll stand up and turn to the TV. All right, I'm looking at his shoulders, his scapulae, his elbow gap, his iliac crest, and his gluteal folds. If you'll just bend over slightly, I'm running my fingers down your spine and making sure it's nice and straight, which it is. Okay, and finally, if you will just turn back and face towards the camera, I'm going to put your feet together and your arms out in front of you. I'm checking for the Romberg test. So close your eyes for 20 seconds. Okay, you can open your eyes. And what I was looking for there was minimal swaying. So you were negative for the Romberg test. And that concludes our assessment. Thank you.
Doing a report on a 17-year-old male who came in today for a peripheral vascular, musculoskeletal, and neuro assessment. I started off the assessment by assessing the patient's neck. He had full range of motion in his neck and no pain in any of the movements that I asked him to do. I then assessed cranial nerve number 11, which is his spinal accessory. It was intact and he had very good muscle strength. I then moved on to his upper extremities. I was assessing his skin, and his skin was intact. There were no lesions visible. His skin was dry and warm, and his hair was evenly distributed. I didn't notice any patches of hair missing, and it looked good. I then moved on, and I checked his skin turgor, which was, he had good skin turgor. He's well hydrated. I then moved on and checked his capillary refill, which was less than 2 seconds. And his nail beds were nice and clean. Then I palpated his radial and brachial pulse, which were both strong and palpable on both sides. They were equal. Next, I assessed his range of motion of his upper extremities. He had full range of motion and no pain in any of the movements asked of him, and he had very good muscle strength of his upper extremities. After that, I moved on to his lower extremities, and I inspected his symmetry. His legs were nice and symmetrical. His skin was intact. There were no lesions. He had dry and warm skin, and his hair was evenly distributed. No patches of hair missing. I did not notice any varicose veins, and he was negative for any edema. I palpated his peripheral pulses, which was his femoral, popliteal, posterior tibial, and dorsalis pedis pulses. They were all intact, strong, palpable. They were equal on both sides. After that, I had him do the heel to shin neuro test, which he was negative for. And then I assessed his range of motion and his muscle strength. He had full range of motion of both lower extremities, including his hips, knees, ankles, and toes. All had good range of motion and no pain, and his muscle strength was very good in his legs. After that, I then did the Babinski reflex, which he was negative for, and then I asked him to turn, and we did the patellar reflex, which he was positive for. I then asked him to stand up, and we did the scoliosis assessment. He was negative for that, and he was negative for the Romberg test.